Welcome back to the Run It Radio podcast. My name's Trina. My guest today is Dr. Gabe Ariciu. Am I pronouncing that right?
You got it.
Yay! Welcome.
Thank you. Thank you.
So, definitely in the world today with the health concerns so many of us have, I think it's helpful to understand and know how functional medicine can play a part and participate, work together with traditional medicine. Would you agree with that? And can you talk more about the differences for people who are just completely confused when it comes to the differences?
Sure, sure. So it's always kind of difficult with that sort of thing. For most people, they're probably getting to know functional medicine. It's growing. It is confusing, I think, for some because they don't like, what does that even mean? Functional medicine, like, what does that mean? I often will explain that it's like it's optimizing health.
Okay.
So you're looking for optimal levels rather than just are you in the lab range or outside of the lab range if you're looking at lab results, that sort of thing. So in other words, you can catch stuff long before it develops into something terrible. But then you also are going a little bit further than your typical medical doctor, conventional medicine, in the sense that you're looking for the root cause, not just to fix symptoms, to cover up symptoms. And so, from a root cause standpoint, we are looking to go, well, your cholesterol is high. Yeah, you may need a medication, or we could look at why it's high and always ask the why question. Why is your why do you have high blood pressure? Why do you have high insulin or blood sugar or whatever number of things that you can go for? And so to one degree, yeah, you work within the medical field to help people, but then to another degree, it's wholly different. And so it can be a bit of a contrast and a bit of a completely different paradigm. So it's kind of a mixture there.
How did you get drawn to this? I've heard your story and I think it's interesting and probably worth other people hearing your own testimony that, you realized something that made a huge difference and impact on your life.
Right, right. So I started getting interested in nutrition early on, but it was more of just an interest because it sounded interesting whenever I took that in undergrad or something like that. But I had no knowledge of it back then. Probably I would totally disagree with myself, whatever viewpoints I had then now. But my mom, she became diabetic, and that kind of spurred me along the way a little bit. But I was still very much going down the idea of I want to teach, I want to be a professor, I want to teach religion, that sort of thing. And then my migraines started getting worse. So I had migraines since high school, but they became more frequent to the point that I was getting them every day. And now that I look back, I probably was getting multiple types of headaches, including the migraines. And that's what, like, it can be hard to differentiate them. But because that was getting worse, I went to a medical doctor while I was in school, and he put me on a blood pressure medication that took it down to like 2 a month, which was way better than every day.
Sure, but still.
But still, I was doing that, and like I didn't want to be on some sort of crutch. I didn't want to have to take something for the rest of my life in such a manner. And I knew that caffeine worked. Like I figured that out by then, that the Excedrin that I was taking every day was the caffeine mainly that was causing some sort of benefit. And then the hopes that chiropractic care would do something came up, and it seemed to help a little bit, but I didn't have any money at the time to do anything, or no withal at all. But as my views started to change, it really, really shifted when I decided to become a nurse.
Okay.
And when I became a nurse, I was working in the field, and I often will say, I wish I would have job shadowed because nursing was not for me. But not that there's anything against it, like they're wonderful. It just wasn't for me. But the
Yeah.
one thing it did for me was it caused a disillusionment with all of Western medicine. I was watching my patients go downhill over simple things and being told to eat certain things that was making them worse. and I just couldn't I couldn't handle that. And so
Mhm.
I started to look at other programs, whether to become a nurse practitioner, which unfortunately was a doctorate. And I'm like, well, if that's going to be a doctorate, I might as well go look at doctorate programs. And so I started looking at DO school, but then a friend of mine said, you should go check out this chiropractor and shadow with me. And so I did. And I liked the idea of just helping people move better, and maybe they would be able to live better because they move better. But I had no idea what I was getting myself into.
Really?
I thought chiropractic was like a PT type thing, where like physical therapy, I thought it was a division of medicine. I didn't know it was a completely different paradigm and alternative school,
Hmm.
because I just
Okay.
had no experience really.
Yeah.
And so when I got into it, and I started realizing that they're just constantly bashing Western medicine or something like that, um, that I was like, what's going on?
Yeah.
And then one of my friends, including a sister-in-law, they introduced me to a really good nutrition book called Nutrition and Physical Degeneration by Weston A. Price. And that really started opening me up. That was written by a dentist some 100 years ago who studied different indigenous populations around the world as they were being influenced by Western diet. And he saw that their teeth were perfectly formed and they had a full jaw until Western diet was introduced. And
Mhm.
within one generation, they had malocclusion, all sorts of issues with their teeth, and then their physical health degenerated and chronic disease set in. And he essentially noted that they didn't have chronic disease to any significant portion before that. And so all that started opening me up. And another friend of mine introduced me to what I do now, which is applied kinesiology. Um, and I went to my first seminar probably a semester after that. And that's when my mentor, Dr. Steve Gangemi, figured out that gluten was causing my migraines. And this is before the gluten craze,
Right,
where
right,
everyone's gluten free.
right.
But as soon as he did that, I went 3 weeks without a migraine until I said, I'm not sure about this. I'm going to have pizza. And then migraines came back.
Goodbye, pizza.
Yeah, goodbye pizza. Well, there's gluten-free pizzas now,
Right.
but I
They
don't eat that
fit.
too often because
Yeah.
it's not that good either. But
We
yeah,
have
that's kind of my health story.
that is impressive. And you're one of the fortunate few that got to experiment on yourself and find this out. So what about people that are struggling to get it right? They've been to, maybe they've seen a functional medicine doctor, maybe they're confused by the traditional medicine route. It gets very confusing for people
Right,
that have so many things going on and they're lost between the two.
right, 100%. So it's hard with the functional medicine world too. Now that it's becoming popular, I almost kind of describe it as a spectrum where you get ones that are very medical, and we have some in the community that are very medical still. And then you get ones on the very opposite side that are very into alternative medicine of all sorts. I'm very much a natural healthcare person. That's what I care about the most. Um, and my viewpoint is I don't want to intervene in nature. I want to work with nature.
Interesting.
And so a lot of people come to me who've gone to other functional medicine doctors, who've gone to even Mayo Clinic. I've had a few that have gone to Mayo. Um, and oftentimes we're the ones that get referred to that because no one else can fix it, including the natural health people. And I think that has a lot to do with applied kinesiology. It really helps us a ton. So in the functional medicine world, we're very much about um, cast a broad net, see what we can catch. And
Hmm.
so if you go to a traditional functional medicine doctor, you're going to run a lot of labs, a lot of labs, some good, some not so good. And they're just trying to catch anything that could be there. And, by all means, definitely like try to figure out what's going on. But there is a huge gap between those labs and whatever results and interpretation there and the appropriate treatment.
Okay.
There's a lot of times, like let's say for instance, going to Mayo is very much going to try to find a diagnosis. They're not necessarily going to find the treatment, appropriate treatment. They're usually going to find the right diagnosis and then send you back to somebody local to get the appropriate treatment. A lot of times it doesn't change what would have been the treatment, if that
Okay.
makes sense. So, like with an autoimmune issue, a lot of times, and I know you have great experience with this side of things, with that sort of thing, you're often going to see some level of immune suppressant, some level of maybe some NSAID requirements, like to balance pain if that's there, or if it's like a thyroid issue, you're going to be on a thyroid medication. The thing that's escaping is why. Why is this there in the first place? Why am I different from the next person? That's like the question I always ask with the migraines. I'm like, why do I get headaches and this person who has the worst posture in the world doesn't get them? Like, that's not fair.
Right.
And so that question always is in the back of my head. And I think that's in the back of most people's heads when they're searching. And then they've gone and then they've met poor results or whatever is going on. And I'm not going to say that I can fix everyone out there. Like, that'd be awesome.
Mhm.
I say my track record's really dang good.
Yeah.
And there are definitely hard cases I've had, really hard cases. But a lot of times it's just, are we actually turning over every single stone? Are we actually looking at every single possibility? Or are we allowing the labs to dictate our care? And
Mhm.
that's something I see a lot of times where the labs are technically dictating and we're just a technician to fulfill whatever it tells us to do.
Yeah. I think a lot of red tape has made it difficult for the traditional medical field to do
Right,
what they need
right.
to do. Like you said, I have a long history with seeing my specialist, my rheumatologist, and I will say he has been very open to functional medicine. I asked him about that. What do you think about this? I think that's something that's an important conversation for the patient to have. There's
Right,
some patient responsibility about finding the doctor on both sides that fits that spectrum that can get you the absolute best care, because like you said, there's a lot going out. You got to cast this broad net so you can narrow down and find out what's going on.
right.
And it's difficult, and their hands are tied more so than they ever have been, which is why we're thankful that there are people like you that are willing to do that work.
Right. And I think you bring up a really good point with the red tape. One of the biggest red tapes that we run into is what does insurance cover and what does it not cover?
Yes. Yes.
And unfortunately, in the alternative medicine world, and I always say it's unfortunate, fortunate, because I
Mhm.
don't want insurance dictating what I do. And
Right.
oftentimes they do. And you have no, and that's what you're meaning with the red tape. Like, their hands are tied to a
Yes.
large degree. And for us, our hands are not tied, but the patient's hands are tied with the financial cost of it. So it can be really difficult for a lot of people. But the wonderful thing is it may cost you less in the long run.
Yes.
It's just hard pill to swallow because you're thinking here and now. You're not thinking a year from now.
Yeah.
It's so hard to think a year from now, especially when you feel terrible.
Yes. Yeah. A $5 copay, but then by the time all the other expenses are incurred, then maybe one or two visits with you that cost more will cut out the other costs that you may see.
Right.
I want to talk a little bit about the kinesiology. Talk about that, because a lot of people don't exactly know. They hear
Yeah.
kinesiology and like, oh, that's enough right there. The spelling's got me. So,
Yeah, like most people don't know it. Yeah,
yeah, yeah.
especially in this area, people don't know it. You see it a little bit more frequently if you're in the bigger towns or on the coasts. But so applied kinesiology is literally what it says. It's applied movement. So with applied kinesiology, we started off with just manual muscle testing, which is something physical therapists do. Um, Orthopedists do it. Everyone does it in our field that uses like some sort of skilled like testing of some sort. And so like most people's experience with it is if they, and hopefully not, get into a car accident,
Yeah.
you often will have a muscle test of some sort to determine whether or not there's nerve damage of some sort. Especially if there's like tingling going down their arm, they're probably going to muscle test you to see what's going on. And so that's where it started off. So there's some PTs early 1900s that started categorizing a bunch of muscle tests, trying to pinpoint how do I test, say, the bicep properly, or how do I test the pectoralis major. And so they're just trying to put that together. And so chiropractor Dr. George Goodhart in I think the 60s started using that to see what else he could gain from it. And he had a difficult patient come to him who had winging of his scapula. So his shoulder blade was winging out and it was causing a lot of pain. And so nothing he was doing with normal chiropractic care that he knew of was touching it. But when the guy described it, when he just showed him how it was winging out, he knew that there was a muscle most likely related, and that's called your serratus anterior. And so he tested that muscle. Sure enough, it was not testing appropriately. And when we talk about this type of manual muscle testing, it's very specific. We're trying to isolate that muscle to the best of our ability. And so the guy tried to do the test, couldn't withstand any resistance to his pressure he was putting on it. And so this Dr. Goodhart, knew where that muscle attached, like we're all taught anatomy really, really well. And so he knew where it attached, and he found along his rib cage several tender nodules of the muscle, so like little trigger points.
Mm-hmm.
And he was like, what if I rub over that and retest it? So he just rubbed over it and retested it. Now the muscle tested fine. So he took that as a cue. I need to go rub those spots. So he did. Painful. It's always painful.
Yeah.
It doesn't feel good. But then his arm was fixed. His shoulder was better. The next day, better, nothing. And so he had no more complaints. And he's like, okay, something's going on here. And so that gave birth to applied kinesiology. Dr. Goodhart, very intelligent, very open guy who was often just wanting to figure out what could we figure out with muscle testing. And a muscle test is almost like a misnomer. It's more of a neurologic test. So you're actually testing the nervous system, and the brain controls it all. As a neurology teacher I had, he said, your muscle is just a piece of meat receiving a signal from your brain. So if it's tight for a reason, and it's not the muscle's fault. You should be looking elsewhere, in other words. And so we're looking for weak or technically inhibited muscles. The brain has shut it down for a reason. Everyone has this happen to you all the time, especially when you're walking. When we walk, we swing our arms. When you're swinging your arms, a muscle shuts down and then then turns on. And so that's kind of what we're looking for, is some sort of weakness in a muscle, which is causing an imbalance. And from there, we try to, like he did, rub over a muscle to figure out what's going on there. But how does this branch over into nutrition? So one of the things they figured out early on is if you put food, a vitamin, a supplement of something like that on somebody's tongue, the brain will recognize what that is, and it could change a muscle test.
Huh.
And so they're like, what the heck is going on with that?
Uh-huh.
And so they started to continue to experiment, continue to test, and they had a group of people trying to figure it out until finally kind of systematized what is now applied kinesiology. And there's hundreds of techniques within it, hundreds of different ways, and it gets really confusing. Whenever I learned it, I got to the 7th seminar and I thought they were going to put it together in some cohesive manner. They didn't, and I was very mad. I'm like, how the heck can you do anything with this? Until I met Dr. Steve Gangemi. And he very much put it into a systematic form. It's an advanced technique is what he does. But to make it simple, every single system of the body, the digestive system, the musculoskeletal system, are all connected.
Mm-hmm.
We compartmentalize them to study and sometimes to our not so good benefit in the medical field, where you go to, say, your GI doctor or to your urologist. But your body doesn't work like that. It's all interconnected. So if you have a gut issue, you're going to see that display in your muscle tissue, or vice versa sometimes. Everything is connected like that. And that's why if you take a pill, it could actually have damaging effects elsewhere while it's doing its beneficial effects.
Right.
And so we take that information and use acupuncture, a bunch of different techniques to then solidify what is going on with the body without a shadow of a doubt, to know the most appropriate treatment at the given time.
About how long can that take with a patient? That sounds like that could be really arduous and time consuming.
So just like functional medicine, you get every flavor of an applied kinesiology or AK doctor. You get every flavor. Sometimes you'll see only 15-minute visits. Like I have a buddy in Arkansas that does it, and he does 15-minute visits. I don't know how. It stresses me out. I can't imagine doing that. But systems healthcare, what I do, I spend 2 hours for the first visit and then an hour follow-up. Vast majority of the time is between 3 and 5 visits to figure it all out. And my track record is by the 5th visit, 80% of people are 80% better by then. That's my track record.
That's great.
I mean, I don't know exactly. Sometimes I ask them, give me 3 months, especially if it's a hard case. Had people come in with just something that seems difficult, like frozen shoulder syndrome, and it was 1 visit. So it can be all over the place depending on what the case is.
You touched on it a second ago, and I've heard you say this before. I've read so much about how more and more we're reading and learning the gut is what do they call it? The second brain or the real brain?
Second brain. Yep.
Talk a little bit about that, if you can, about some of the things that we could be doing before we have to come see you.
Right.
To prevent problems or learn about ourselves in the gut.
So gut, super important, probably the primary thing that I go after with most patients.
Okay.
It's not always the thing, but it is by far the most common. It's the entrance to the body. And so really your gut, and this is weird for a lot of people, it's external to the body.
Huh.
Because as you go from the esophagus all the way out, all of that is considered external. And so 80% of your immune system is in your gut.
Wow.
And then further, a good portion of your neurotransmitters are created in your gut. Mm-hmm. So 90% of your serotonin, if not more, 50% of your dopamine is created there. Really, really important. So if that's off, you know the brain health is going to be off. Then you can run into this whole leaky gut syndrome, which is really, really important. Important in autoimmune, important in many, many cases. And if you have leaky gut, you got leaky brain too. It's almost guaranteed. And so with all of those things, what can we do? Number 1 is going to be diet. Number 1. And as hard as it is for people, you got to fix it. And usually what I tell people, especially before coming to see me, if you want to do something on your own, eat a paleo diet. Meat, fruit, and vegetables, whole food, no more junk food, no more processed food, no more sugar. Eat whole foods that are good for you. Get lots of protein in. But meat, fruit, and vegetables, organic if you can, that's going to be far more helpful. Grass-fed beef, grass-finished beef, that's going to be far more helpful. For those who can handle dairy, that's going to be the question mark. It could be really healthy, or it could be the cause to all your symptoms. That can be really not so helpful if you're going to include that. That's why paleo diets don't. And then for those who have autoimmune, they may have to go for an even further step, which is the AIP diet. Autoimmune protocol diet, which removes all the things that paleo does, but also nightshades and eggs. And that makes it nice and fun. It's difficult. But yeah, usually paleo diet. Get on a paleo diet, then clean up some other things too. Filter your water. Make sure things at home are clean. Like we often don't think about what we're putting in our mouth, like our toothpaste, or are we using mouthwash killing off our bacteria every single day? Shouldn't be doing that. And what kind of shampoos are we using? What kind of things are around us that could be damaging us? Yeah. The list gets long.
It does. It gets overwhelming and scary too. Any tips for people that are wanting to do that, but it seems like so much? I always read and hear, start small. But what would you say to those people? Because they will just think there's no way I can do it. I'm not even going to try.
Throw up your hand, throw in the towel.
Yeah.
Diet first. Like water's not too hard if you want to just get a good filter. Like there's quite a few out there. Clearly filtered is pretty good, and you can get a little tabletop one of that. I used to use a Berkey, but then they've kind of gone downhill, unfortunately. And there's just lots of different sources for water. Just look for a really good one that removes a lot of stuff. That's simple, at least. Just means buying it and setting it up. From a food standpoint, depends on where you shop. So here local, I'm going to tell people Aldi's probably the easiest one to get started with. We still use Aldi. If you got a Costco membership, that's also easy. It's a lot easier than Sam's with some of their products. So you want to start with probably first removing what's in your pantry, because you don't want the processed foods in your home. Because the day that you have a hard hard, stressful day is the day you're going to eat that stuff.
Mm-hmm.
So you want to get it out of the home, and hopefully everyone in the family's on board, because that's where it's hard.
Yeah.
But if not, you want to start with the pantry, remove the processed foods, remove what's in the kitchen and in the fridge, and then go out, get fruits that you enjoy, get vegetables that you enjoy. And that includes potatoes. A lot of people ask about that, but that does include potatoes. And then get good meat. And then if you want to take a step by step towards meat or any of these things, even organic, take a step by step. At Aldi, they do have grass fed beef. I don't know how good it is, but at least they have the option. They have organic fruit and vegetables there too. So maybe you start with just apples. One of the things I tell people is Google the dirty dozen. If you Google dirty dozen, it's going to pop up with 12 foods that you should get organic. Strawberries, I think, are still number one. Apples might be number 2 or 3 now, but there's several that are on that list that, yeah, get those organic, but then the rest of them, don't worry about it right now.
Yeah.
But yeah, that would be my first steps. And then you can think about the detergents and everything else much later time, because you got to pick your battles today. There's no way I'm going to have a completely clean home because it's ridiculously expensive.
Right. So the gut's very important. I know sleep is super important. And when you're eating well, you're going to sleep better. But do you have any other tips for people that are struggling with getting a good night's rest?
So yes, it is probably the most common thing that I have in my office, that they will report that they wake up multiple times at night, or at least one time between 1 and 4 o'clock, somewhere around in that time period. Sometimes waking up for an hour and they can't get back to sleep. 99% of the time it's blood sugar issues. So what happens is, in the middle of the night, your blood sugar drops, your brain detects it and kicks on your adrenal glands.
Okay.
As soon as that kicks on, you got adrenaline pumping out or cortisol pumping out. You're awake.
Yeah.
For sure. And so with that, it's getting your protein to 100 grams a day as the bare minimum. And if people want to know what that looks like, it's a pound of meat. It's a lot more than most people eat. But if you get that spaced with 3 meals, 5 hours apart, without snacking, that will go a long way with helping the blood sugar to stabilize for overnight. Now, some people will have to go an extra mile and keep the carbs down and be on the low carb diet to counteract that. Otherwise, then we're going to get into a more tricky situation where what is keeping you up at night? Is there something else affecting you? Like, I actually just had this issue where I was like, what the heck is going on? I'm having a hard time sleeping. And it was an ammonia toxicity. I'm having a hard time breaking down ammonia. And ammonia comes up for a variety of reasons. Most common, bacterial infection of some sort or imbalance. Sometimes it's just you're lacking a nutrient. And if you lack that nutrient, then you're going to have a hard time breaking down ammonia, and you're going to have a hard time sleeping. And so that could be there. But there's other things too. That's not as common. Blood sugar for sure is the most common. The other one would be for those unfortunate people that deal with anxiety. And if you deal with anxiety, oftentimes, like, they're in the functional medicine world, they're going to give them GABA, which is the thing that calms down your nervous system. For me, I'm going to look at, why is GABA not working correctly? And oftentimes there's a vitamin, like a B vitamin or something like that, that's missing. And then I look for, will passion flower help you, or valerian root help you? Those are actually 2 nice herbs that somebody can take in the, like, an hour or 2 before bedtime, and it might actually help them. I generally don't advise taking hormones, though melatonin has helped a lot of people. So it can be a tricky situation if it's not blood sugar and that blood sugar diet doesn't work. It can be a little bit tricky to get to where you need to be, but those are at least some helpful tips that could. And mind you, valerian does not taste or smell good.
Your thoughts on when to stop eating before bed? I recently spoke with someone that was experimenting with themselves, and they thought taking some sort of carb, honey, anything right before bed was fantastic. You've heard other people say stop hours before you go to sleep. Is that determined on the person, or do you have any one size fits all ideas on that?
I think ideally 3 to 4 hours before bed, most likely. But it also kind of depends on the person. Like I can eat before bed and it doesn't bother me. I mean, is it the smartest thing on the planet? Not really. But 6, 7 o'clock probably is the latest, depending on when they're going to bed. And hopefully they're going to bed at a good time. So that'd be
Yeah.
another key thing with sleep. It's like
Right.
if you're going to bed at midnight or 1 o'clock, there's something else that needs to change.
Yeah. Yeah.
If you're a night owl in that sense, that's just really difficult on the body. But 10 o'clock, that's generally a good goal to shoot for. And then 3, 4 hours before that, make sure you're done with eating your meal.
All right, we've talked sleep, diet. Let's talk a little bit about exercise before we go. There are a lot of thoughts on that. It feels like the needle's always moving on how much or how little we should do and what kind. What are your thoughts on that?
So it depends on your overall goal, depends on what you enjoy, and long-term health.
Okay.
So we live in a very sedentary society. And that alone is one of the things that's going to dictate what's most beneficial. Now, I have a background where I like lifting weights. I
Mhm.
like it. It has a fantastic benefit in that you're going to put on muscle mass and bone density. There's nothing like it. Sprinting might be the closest to it from a more cardio look-like standpoint. But when it comes to like endurance running, you have to be somewhat careful with that if you're not including any strength training, especially for like weight loss type stuff. But generally speaking, I'm going to tell somebody, do what you like, get movement in, walk 30 minutes to an hour every day if you can, which I'm terrible at sometimes. Hike, get out in nature, and I think you should do some sort of strength training 2 to 3 times a week. Something like that.
I agree. And I couldn't also, I'm glad you said, sometimes we're terrible about it. We don't all do exactly by the book, but you just got to pick it back up and get back into the swing of things. And tell people where they can go to follow along or book an appointment with you if they're interested.
Sure. So I have a unique last name, so it made it really easy to make a
Yes.
website. So it's drariciu.com, drariciu.com. You can book from there. You can read some of my blogs. Don't criticize me too much. I didn't go through some of the older ones whenever I transferred my website. So I was like, just on that the other day, I was like, man, that looks terrible. I probably should fix that. Oh well. But that's a good place. I'm on Facebook and Instagram. I'm trying to make a plan to actually do something a little bit more with that. It's been probably 3 months since I've
Yeah.
done anything with it. But we'll see. But that's usually the place you can find me.
All right. And let's see. Oh, are you still doing a podcast too that people can tune into?
So it's on and off. I need
On
to
it.
actually talk to
Gotcha.
the guy. Dr. Houston Anderson is who I do it with. He's really busy with homeschooling and stuff. So
Okay.
like whatever little bit of time he has just goes to that. So I'm like, we'll see what happens.
Sometimes you got to strike things from the list.
Yep, sometimes it is.
All right. Thank you so much for spending some time, clearing some things up, giving us some tips on living a better life. Come back anytime, Dr.
Yeah,
Gabe Ariciu. Appreciate it.
thank you so much. Take care.
Bye.